I graduated from med school almost 50 years ago in 1970, and that's when I started becoming a pediatrician. When I got to pediatrics, when I rotated through there, I just loved it. The kids are, you know, so open and talk to you, and they don't, you know, they generally don't have a lot of complications, and they get well fast.
Dr. Ice is an icon in the community because you can go basically anywhere and mention her name, and people will say, oh, I know her. I know someone who has gone to her, or either I've seen her. You know, she treated my children. And it makes me feel good to know that when her name is just mentioned, people light up and just have good things to say about how she has contributed to the upbringing of their children.
I just always wanted to, you know, to make a difference in the Black community. Many of the people that live in Detroit are indigent and have Medicaid, and doctors that they may want to go to may not take the Medicaid, and so we've always taken Medicaid. But of course now it's really been difficult to manage the practice because you know, every year they're just cutting back on the amount that they're going to pay you for Medicaid patients.
It was so important for this practice to survive because the people that we serve are lovely, and they're so, in different ways, they are vulnerable. They've gone through a lot. The things that our parents and families and kids are going through, it's crazy that they're getting out of bed and putting on their clothes in the morning. So the fact that they bring them to the clinic is incredible. Just shows what fortitude they have. And so as a pediatrician, my main goal would be to help out those families. And Dr. Ice has already built relationships with so many people who otherwise might be not as open to the medical community. And so she's formed those relationships, and it would be a shame to lose that.
Well, I'll tell you, for one thing, Authority Health has helped me a lot, yeah, because having the residents here and having them, you know, having their community orientation has really been good, and the patients have enjoyed the residents, you know, they like the residents.
My training here with Dr. Ice has been an amazing experience. Being at the hospital, even being out in the community, you kind of mentioned Dr. Ice's name, and several people know and admire her, and I feel very privileged and lucky to kind of be a mentee of hers throughout the years. She has a lot of wisdom in pediatrics, from being a hospitalist to a general practitioner to, I would say, a community med doctor.
The teaching that I do helps me to learn more, but it also helps the residents to learn more. And I really believe that we have to help the people that are, you know, coming behind us so that they can understand our philosophy and understand what they need to do to try to really be a force in the community. You know, people say that I've been pretty good for the community. I know there are a lot of people. I'm always running into people everywhere who say, oh yes, I used to bring my children to you, or I used to bring my child to you. So I'm not saying that I have a good reputation, but people tell me I have a good reputation. I don't know. But I really have been very fortunate to be able to be in practice as long as I have and see all the different patients that I have. And I've learned a lot, and I hope the patients have too.